Hello, everyone. Thanks for joining. We are going to today walk through the U.S. Guidelines for alcohol consumption, specifically the dietary guidelines, which are geared towards adults. Then we'll talk a bit about the current patterns and trends in alcohol consumption, followed by highlighting some programs that the industry is offering to help promote responsibility and moderation and educate people, especially people across the hospitality industry, on how to promote these. So to start with the alcohol recommendations, in January, new dietary guidelines for Americans were released. These dietary guidelines had recommendations for alcohol consumptions, again, for adults. And the dietary guidelines have had recommendations for alcohol since the very first edition came out in 1980. Over time, the guidance has largely stayed the same, with the overall message being, if you're an adult who chooses to consume alcohol, you should do so in moderation. Over time, additional information was added that specified what moderate drinking was, what counts as a drink. And then in 2026, the 2025 to 2030 dietary guidelines were released. Now, the dietary guidelines are updated every 5 years. They are put out by the Department of Health and Human Services and USDA. It's a joint effort. They serve as the foundation for federal policies and programs related to nutrition, and also serve as an important resource for consumers and the people who serve them, including health providers, dietitians, nutritionists. The dietary guidelines are based on the best and most current research and evidence on a topic. In preparation for the release of each edition, a review of the research on the topics that are included is conducted, and if there is a preponderance of scientific evidence and medical knowledge to make a change, there are updates made. This most recent version did have a new look and feel. The past several editions were multi-hundred-page documents that had all of the guidelines as well as information about the science that went into developing the guidelines. This new set of guidelines was released in a simplified, consumer-friendly format, just 10 pages long, and then it had accompanying scientific foundation documents. So all of the science that was in the previous editions, right in the dietary guidelines, that science and information it still exists. It's just in accompanying documents, a scientific foundation document for most of the topics in the dietary guidelines, and then a report that was specific to the alcohol science review. That science review was conducted by the National Academies of Science, Engineering, and Medicine. They conducted a consensus study review of the evidence on alcohol and health, again, focusing on adults, because the dietary guidelines, while they also indicate that there are some people who should not drink, the recommendations for alcohol are geared towards adults. And that scientific review document for this most recent release concluded that, in part concluded that moderate alcohol consumption compared to not drinking ever, so moderate drinkers compared to never drinkers, they do have a decreased risk of all-cause mortality, which means on average, moderate drinkers live as long or longer than those who have never consumed alcohol, as well as a decreased risk of cardiovascular disease. The report also found that moderate drinkers have an increased risk of breast cancer compared to never drinkers. This report, when it reviewed the science, it retained the long-standing definitions of moderation and standard drink equivalents that have been used for decades in the US and in the dietary guidelines themselves, specifically defining moderation as up to 2 drinks a day for males, up to 1 drink a day for females, and defining 1 drink based on the amount of pure alcohol that it contains. So that means that whether it's beer, wine, spirits, any drink, it's based on having that 0.6 ounces or 14 grams of ethanol. That's an important piece to remember in the dietary guidelines, that they are not recommending making alcohol recommendations based on product type. They are making recommendations based on standard drinks, recognizing that when it comes to alcohol, there is no beverage of moderation or drink of moderation, only the practice of moderation. So whether it's in beer, wine, spirits, ready to drink beverages and cocktails, they all can, 1 standard drink of each contains the same amount of the exact same pure alcohol, which is ethanol. Now, while this most recent release of the dietary guidelines was simplified, the alcohol recommendations are in line with the recommendations that have been in the guidelines since the very first edition. Again, the overall takeaway being, if you're an adult who chooses to consume alcohol, you should do so in moderation. Specifically, the guidance in the 2025 to 2030 dietary guidelines says limit alcohol beverages and consume less alcohol for better overall health, and then goes on to list some of the people who should not drink alcohol at all, avoid alcohol altogether. And you can see when you compare that to the previous edition, that language was very similar to language that was in the previous edition, in which said drinking less is better for health than drinking more, and also again noted that there are people who should not drink at all. Again, the earlier edition did have the additional information about alcohol and health. That information still exists in the accompanying scientific consensus study report. So while you would have to go to an additional document, the information was not lost, nor were the definitions for moderation or definitions for what counts as 1 drink. With that information and understanding the overall guidance that American adults are given when it comes to alcohol consumption, I'm going to turn it to my colleague, Dr. Honig, and she'll give you a review of the landscape of alcohol consumption in the US, both for adults and also looking at underage as well.
Thank you, Dr. Berger. So today I will be presenting on data from the National Survey on Drug Use and Health, also known as NSDUH. It's a government survey conducted by the Substance Abuse and Mental Health Services Administration, or SAMHSA, and it's a leading source of population-based statistical data on alcohol in the US, and it is the largest survey on drinking patterns and trends. Each year, around 60,000 people, 12 and up, are surveyed each year, and they're surveyed online and in person. Respondents live in all 50 states and the District of Columbia. And for this presentation, I'll be using a number of years of data, but the most recent year you'll see goes up to 2024, which is the most recent year of public use data. So I'm going to try, this is, I promise, the most busy slide you're going to see. I know that people may not love data, so I'm going to try to make this as painless for you as possible. You will see, I'm going to start off by telling you, you'll see a gap for 2020, and that is because of methodological changes to the survey. There is a trend break. So you'll see the data from 2015 to 2019 trending, and then the recent years of data, 2021 to 2024. And in those recent years of data, 2021 to 2024, we see that more than half of American adults currently drink alcohol. and that is defined as drinking within the past month or past 30 days. And the percentage has stayed relatively stable in recent years. We see it was 52% in 2021 and 51% in 2024. But we did see some differences by age group. So in the younger ages, that's 21 to 29, and then 30 to 49, we see there was a slight decrease. However, in the older ages, 50 to 64 and 65 plus, we saw a stable trend among those groups. And when we look at sex differences, we see that among males, there was a decrease in current drinking in recent years. However, it remains stable for females. And turning to binge drinking, we see a decrease among everyone. So we see that overall category in Black of 21 and older, we see a decrease there. And we also see a decrease among males and females. This shows binge drinking by age group. So that first column, the first 4 columns again are that 21 and plus group. We see the largest decrease is among the younger group of 21 to 29. We also see a decrease among 30 to 49, but similar to overall consumption, 50 to 64 and 65 plus remain stable. And looking at alcohol use disorders, we see they also did decline in recent years. We see that again by the younger age groups, then it's more stable among the older groups. So you see a pattern going on here. We're saying the younger groups for harmful consumption are down. It remains a bit more stable among those older groups. And then we also see, we also see a decline there for females as well for alcohol use disorder. And now we're going to look at underage drinking, which in the context of the NISDA survey would be those 12 to 20 years of age. And we see that overall current drinking declined in recent years overall and among both males and females. However, when we look at binge drinking among these 12 to 20-year-olds, we see that has remained relatively unchanged in recent years. However, they are still at historic low levels. So the big picture, what is all of this data saying? It's saying that current alcohol use among adults has remained stable with harmful consumption declining. We also see that underage consumption is at an all-time low, which is also excellent news. And now I will be turning this over to Maureen Dahlbeck to give us some information on responsibility.org.
Thank you. Responsibility.org was founded in 1991 by America's leading distillers. It is a national independent and not-for-profit organization working to promote a lifetime of responsible alcohol decisions. While Responsibility.org remains primarily funded by the distilled spirits industry, in 2025, our board of directors expanded our partnership structure to welcome beer, wine, distributors, hospitality partners, retailers, and other groups who are committed to the same missions that we are. The belief is together we are broadening our reach and strengthening our collective capacity to deliver on our missions across industries and communities. Responsibility.org takes an evidence-based and partnership approach to delivering on its core missions. Those 3 core missions are to eliminate underage drinking, to eliminate drunk driving and work with others to end all forms of impaired driving, and to empower adults to make a lifetime of responsible alcohol choices. Focusing on those 3 missions, we have a variety of programs, and they focused on eliminating underage drinking. Ask, Listen, and Learn, our flagship program, targets ages 9 to 13 for both the students, the educators, and their parents. Alcohol 101 Plus is our college-based program. And We Don't Serve Teens is a community-based program for retailers, hospitality venues, anyone who may have access to youth trying to obtain alcohol. Our second mission, to eliminate drunk and impaired driving, focuses on a variety of other programs. Our National Alliance to Stop Impaired Driving, the CARS program, which is the Computer Assessment and Referral System. This is a mental health screener, which provides a brief intervention and referral to treatment that is based on an individual's localized area. The idea here is that we know 40 to 60% of first time and repeat DUI offenders have comorbidity between alcohol use disorder and a psychiatric disorder. We provide resources, webinars, and a variety of other materials for those who practice within the criminal justice and law enforcement arenas. And then knowing that 2/3 of drunk driving fatalities involve a driver with a high BAC, we also have a high risk impaired driving initiative. Today, I want to focus on our empowering adults to make a lifetime of responsible alcohol choices through our programs that focus in this area. The first program I'm going to talk about today is Responsibility Works. This program was actually designed with the industry in mind, and it provides employers and employees with a tool that allows them to provide educational information around alcohol. There are 5 interactive units that cover alcohol basics, drunk and impaired driving, health and well-being, responsible decision-making around drinking, including not drinking, as well as scenarios that let the individual role play to use the skills that they have developed throughout going through the program. Responsibility Works, what is unique about it is it really recognizes that employees are an ambassador for their company. So this program is designed to help them model responsible and mindful choices about alcohol in both their professional and personal lives. It follows the U.S. dietary guidelines for consumption and serving size. It promotes responsible decision-making around alcohol consumption, and as I previously said, including not drinking, as well as responsible serving and responsible hosting. What is also unique about this program is it can be customized. So it can be designed to include a company's own resources, as well as brand it to identify that company with their logo and their colors and different things like that. The next program is an app, and this is called the Virtual Bar, and it is an interactive and quick and easy to use tool that allows an individual to estimate their blood alcohol content in a virtual and safe setting. Individuals provide some basic information, their weight, their gender, their sex, their height, and this creates a profile that then they use to factor in different things: what they drink, what kind of food they've eaten, how fast they've consumed the alcohol. And this tracks their BAC and gives them a comparison, if they want, to someone of the same gender as themselves. If you're on a date, you can see what the same amount of alcohol, if you're matching drink for drink, is. And then what it really does at the end is teach you how long it takes for your BAC to return to 0. So we recognize that some people may overconsume, and if they do, they need to know that while they may think they feel okay to drive, they are probably not okay, and that you may actually still be impaired the next morning based on that. So real quick, it is designed to help users understand what a standard drink is. It provides information on standard servings, ABV, the different factors that affect a BAC, and then what different drink choices and how fast or slow you drink affect their BAC, and then how all of this plays into their behavior and their impairment. This app is available free on both the Apple Store and Google Play. The next tool is something newly created called Understand the Standard, and it is designed for people of legal drinking age to better understand what a standard serving of alcohol is in a fun and interactive virtual setting. Individuals practice pouring the perfect pour. There's a container and different drinks. There's wine, there's ready to drink cocktails, distilled spirits, and beer. And so individuals using their computer can quickly determine if they understand what's in their glass, and understanding how much alcohol they are consuming as a key step to responsible alcohol consumption. What we do know from data is that only 1 in 4 adults can correctly identify that 12 ounces of beer at 5% ABV, 5 ounces of wine at 12% ABV, and 1.5 ounces of distilled spirits at 40% ABV contain the same amount of alcohol. So when the container size changes, it does necessarily mean you're having a standard drink still. And so this tool was developed for that. This tool is also free. It can also be embedded onto individual websites. And then I will turn it back over to Dr. Berger.
Thanks, Maureen. So we will summarize some of what we just walked through, but adding to the programs that responsibility.org offers at the Distilled Spirits Council, we also have long partnered on the dietary guidelines to produce a number of materials for consumers, health providers. We offer many of our materials in both English and Spanish language. 2 of the websites that you can check out are drinkandmoderation.org, which takes you to a page on the Discus website, and that page provides links to a number of different print resources, videos, tools, calculators, as well as additional information about the dietary guidelines for Americans, the science that they're based on, and some of the industry efforts that Discus members have been participating in to promote responsibility and to help ensure that consumers are informed, including our voluntary commitment that went into place for our director level members a few years ago to start voluntarily adding serving facts information to our products, which is another way that consumers can think about whether and how alcohol might fit into their dietary patterns, on top of thinking about the recommendations around moderation and knowing what counts as a drink. On standarddrinks.org, there are some similar resources, but the jewel of that website is the Standard Drinks Calculator. There are other calculators out there, and some of them oftentimes are very limited in the selection of drinks that you can pick, or may not allow you to add your drinks up over the course of a night, or might ask for a lot of information when ultimately all you really need to know how many drinks are in your container are just 2 pieces of information. The volume, so that might be ounces or milliliters, and then the amount of alcohol, typically presented as alcohol by volume, ABV, or in the case of distilled spirits, proof. So just with those 2 numbers, which are found on all of the distilled spirits products labels, you enter those in, and it can add up how many drinks you are in that container. You can use it for recipes if you're planning a get-together, a big party. You can estimate how many drinks will be in a recipe that you're making. So it's a really handy tool for both tracking your own consumption and also planning ahead. In general, the resources that we put out and our messaging in general is that adults who choose to drink should do so responsibly and in moderation. They should always talk to their own health providers to help determine what's right for them, because individual risk factors, including things like genetics and family history and other lifestyle and behavioral factors, all matter. And talking to a health provider is an important step for individuals to decide what's best for them when it comes to alcohol consumption. So to sum up, the dietary guidelines for Americans, which offer information about diet and nutrition broadly, they have included alcohol recommendations from the very first edition up until the most recent release in 2020, January 2026. Even in the simplified 10-page document, it was still an important piece of information for consumers and the people who serve them to recommend that that alcohol be limited and that consuming less is better for overall health than consuming more. These dietary guidelines, again, while they are simplified, I think one of the common misconceptions about what was retained in the simplified guidelines, it's important to note that the science that underpinned the guidelines retained the definitions of moderation and standard drinks that have long been in the dietary guidelines, and provide the information about alcohol and health is also presented, again, just in an accompanying document. When looking at how Americans consume alcohol, I think that there have been a lot of discussions over recent years around whether people are drinking less. And I think the important takeaway here is, in terms of people who currently drink, the percentage of Americans who currently drink has stayed about the same in recent years. What has gone down, and this is important progress in this area, while there's still more to be done, of course, but harmful consumption has been on the decline. And that includes binge drinking for both adults and underage. It includes alcohol use disorder, and it includes underage drinking as a whole. Now, those statistics that Dr. Honig presented, those statistics are based on the U.S. federal NSDA survey. So that information was collected by an HHS agency that represents the leading survey that is used for U.S. surveillance of alcohol, as well as other factors, including drug use and mental health. And so Jennifer presented those up till the most recent release of those. But those don't represent numbers that the industry collected. Those are the U.S. Nationally representative numbers. There are other surveys that are conducted nationally or nationwide, in some cases, including some other sources of information about alcohol within the federal government. For example, CDC collects some information on alcohol. There are other surveys that are specific to underage young people, like Monitoring the Future, which captures data from 8th grade, 10th grade, and 12th grade. And the statistics that Dr. Honig presented are in line with the other sources. So while important progress has been made, there's still more to be done, and the industry is and can continue to play a role in that, in both promoting moderation and responsibility and working to prevent or reduce harmful consumption. We gave you some examples today of what's available through both the Distilled Spirits Council and responsibility.org. Generally speaking, ways that we can support responsibility, whether we are members of the beverage alcohol industry, the hospitality industry, or just in our day-to-day lives. Of course, the common sense approach that the new dietary guidelines took, I think the common sense approach can also be used here. Always make sure that water and food are available when alcohol is served. Offer mocktails or non-alcohol beverages if you're serving alcohol. When you are coming up with recipes, crafting new cocktails, try to ensure that the recipes that you're making are developed to be one standard drink or less. You can use the standard drinks calculator that we showed you as one way to do that. And of course, you can use standard drink measuring tools like jiggers, which will provide the 1.5 ounce pour of a distilled spirit, which is what counts as one standard drink. 1.5 ounces of a distilled spirit at 40% ABV contains that 0.6 ounces or 14 grams of alcohol. As you are serving your friends, families, customers, try to avoid topping drinks off before they are finished. I know that is something that is easy to do without thinking, and as you're walking around with a bottle, it might be easy to top something off. But if you can avoid topping drinks off before they're finished, it can help people keep track of how many drinks they're consuming. Of course, one container doesn't always mean one drink. I think in some cases that is very self-explanatory. For example, a large bottle of a distilled spirit. But in other cases, that may not always be immediately evident that one container doesn't equal one drink. For example, a high ABV beer, even if it's 12 ounces, it might be the equivalent of 2 or more standard drinks. So being aware of not just how many containers, but what's in the container. And for you to take home with you the resources that we presented, which are either QR code or linked throughout, encouraging your team and your colleagues to learn about these same concepts. This webinar will, of course, be made available free and on the Discus Academy website for anyone who wasn't able to attend. And for you, remember that one of the best things that you can do is set the example. When you are enjoying your cocktail, your drink, as you raise your glass to give a cheers, consider the practices of moderation and responsibility as you consume alcohol as well. And do enjoy responsibly if you choose to consume alcohol. As Dr. Oz said, when the dietary guidelines rolled out in January of this year, alcohol can serve an important purpose when it comes to social connectedness. Millions of American adults enjoy a drink with their friends and families, their colleagues, their neighbors over dinner, over an outdoor get together. And that's a good thing to bring people together. Just do so responsibly and in moderation. So with that, we will open it up to have some time for questions and answers. We are going to turn we are going to stop the recording here.